Now, since the global epidemic broke out late last year in China, it has become a topic of global concern, with several countries recording multitudes of deaths and infections. Africa was the last to confirm any infections, with Kenya confirming its first case just a few weeks ago. However, there is still a lack of civic education in the country, with the Health Cabinet Secretary Mutahi Kagwe yesterday urging Kenyans to stop treating the virus as a joke and accord to its seriousness that it deserves. Now in studio to help us understand the basics of the COVID-19 virus, from symptoms to treatment to safety precautions, is public health expert Ken Ogendo. Very good evening, actually. And I also have a special guest who is just as curious about the COVID-19, and I will allow her to carry out the interview. She is none other than Petra Ayar. Good evening to you, darling.
Good evening.
Okay, take it away.
Hello.
Hello, Petra. How are you?
Fine. So I have 11 questions I'd like to ask you.
Oh, that's scary. 11 questions. Okay, take it away.
The first question is, how does COVID-19 spread?
So, COVID-19 is a disease, and COVID-19 has been coined from the words coronavirus disease, and it was first spotted in China, November 2019, after a whole year of virulence, and hence coined, experts who classified it, coined it COVID-19. However, COVID-19 is a disease, but it is caused by a coronavirus. So just like HIV caused AIDS, there is a coronavirus that causes COVID-19 disease. It's just a small tweak. So it spreads by droplets. For example, if you cough or sneeze, I don't know whether we are at 1.5 meters, as the STS is saying, on 1 meter. However, we are recommending 1 meter because droplets onto a surface, or you can easily inhale them as you inhale and exhale air, and they can get into your system and cause damage to your lungs and all the way to organ failure. So it is spread by person to person, and when you touch surfaces which have been predisposed to the virus, then you can get the disease. For example, it travels from, just assume the microbe is not visible. Assume this is the virus. I have it, we are just role playing. It is not airborne per se, and that's why people are being told to keep distance. So it can move from one place to the other. So in a span of 1 meter, you could be safer, but unless, like if you're too close, then if I exhale that, in case I'm infected, then you inhale it. So, but if you're far from me, even if I sneeze or cough, the virus can't move so far. It will likely go and fall on a surface. And that's why you're saying everywhere, Kenyans and the globe have to disinfect every surface, because people are coughing, people are sneezing, and you never know. Yeah. So it's spreading from person to person, and it first originated from animals. Yeah, continue.
The second question is, what are the symptoms of COVID-19?
Good question, Petra. So COVID-19 symptoms are flu-like symptoms, and the very first cardinal symptom that is even being checked in the airports and the borders all over the world right now is fever. When you get infected, you have high body temperatures, hotness of the body beyond that 7.5. And the other cardinal sign for COVID-19 disease is cough. The cough is actually dry, and shortness of breath. So those three combined, you are likely to be suffering from COVID-19.
The third question is, does COVID-19 have a cure?
COVID-19 does not have any cure. There are no vaccines. There are no antivirals to stop it. There is no treatment available right now. The CDC and other research organizations are now putting their hands on deck to make sure we get a vaccine, we get a cure. But as of now, there is no cure. Taking a hot shower, guys, will not help you. You just need to go for support at the health facility where they give you fluids and rest, but there's no cure.
The fourth question is, when should you call for medical help and how?
Very good question. So if you suspect or if you find someone who has traveled to a country that has got this disease, or you suspect you have got the symptoms you just talked about, you've got fever, you've got shortness of breath, and you're coughing, then you are supposed to seek medical help. We have a hotline number which is toll-free right now in Kenya. You call 719. In the US they call 999, no, 911. But right now in Kenya, boys and girls, moms and dads, call 719 and they'll give you help. Or you just walk yourself to a health facility and tell them, hey, I suspect that I have these symptoms. Could you please have me checked, by the lab, and they'll help you. They'll help you. We have a very responsive government right now, and they're taking care of everyone.
The fifth question is, how does temperature affect the spread of COVID-19, if it does?
Well, when COVID-19 began in Asia, there was a very big, rumor that maybe it does not affect people who have got higher melanin, the skin color. They were saying that Africa might not be as exposed as other countries or other areas of this world. But I would like to say that is actually a myth, because right now, in fact, today we have had the first case of coronavirus death in Africa, in Burkina Faso. So we need to accept that we are as vulnerable as an Italian, we are as vulnerable as an American or a Chinese. We are all the same, we have got the same blood running. Of course, research is going into it. People are saying, research is saying that this virus can survive between 21 and 27 degrees Celsius. Beyond that, it cannot survive. But remember, your body temperature is 35. So once you get infected, you cannot even say that I'm going to take a hot shower. Some people, throwing those myths, which you want to demystify and say, if you get this disease, whether in Africa, whether in Asia, whether in Australia, then you need to seek for help and get the necessary support by the health facilities.
Now the sixth question is COVID-19, COVID-19 is called a pandemic. So what is the difference between a pandemic and other diseases that are there?
Wow, good question, Petra. You sound like you've done public health, and I hope you do it in the future. So COVID-19 is a pandemic. And here from an epidemiology perspective, we have got epidemics, and we also have got pandemics. An epidemic is a disease spreading within a localized region. For example, once upon a time, we had a cholera outbreak in Nairobi, and it went to a few counties. We could easily call that an epidemic. Do you remember that, Petra? Sometimes back last year, but one, I think. And for a pandemic, you have the infection moving not only from county to country, but from country to other countries in other continents. So this virus has traversed China to Africa, to America, and to Europe. So it is a pandemic. It's actually affecting the globe. Hence, we call it a pandemic. Even Ebola was a pandemic back in the day. And from our business news, you saw even the Black Death and so many other diseases, SARS, MERS-CoV, they have all shown the same character traits.
How does COVID-19 compare to other pandemics in the past?
Wow. So COVID-19 is a pandemic of unique nature. We have SARS. SARS was, SARS means severe acute respiratory syndrome. It happened in China in the year 2003. We also had MERS-CoV. MERS-CoV means the Middle East Respiratory Syndrome. It was also in China. And in fact, once upon a time, I was working in the airport, and guess what? In 2014, we were screening people for both Ebola and MERS-CoV. MERS-CoV and SARS, those two viruses, they actually cause the same flu-like symptoms. However, interestingly, the case fatality rate, let me break it down for you. Case fatality means the number of people who die. Out of the number of people exposed to a disease, how many of them die? For example, in China right now, we're saying the case fatality rate is at 2.3%, meaning out of 100 people who are exposed to coronavirus disease, COVID-19, then 2 of them will die. For SARS, the case fatality rate was at 10%, meaning out of 100 people, 10 people were dying at the time. When we had MERS-CoV in 2012, 2013, all the way to 2014, the case fatality rate was at 35, meaning out of 100 people who were exposed to MERS-CoV, 35 could die. So interestingly, the coronavirus disease is not as virulent in terms of case fatality as compared to these other two when you look at them from a pandemic perspective. Ebola was actually very vicious. In fact, Ebola in West Africa and Central Africa and many other places, it was, even the health workers were not able to contain it for a long time. They had to put in a lot of measures. Do you know actually Ebola virus, first of all, cleared the witch doctors because people were not aware that you need to go to a facility. They could see blood coming out of their bodies and they thought, oh, I need to go and look at that witch doctor. The witch doctors didn't have information. So maybe, Christians were arguing, oh, it's so good, we killed all the, but from a public health perspective, we don't want anyone to die. So what I'm saying is the pandemics have been different. They have been acting in a different way. And this time, we do not want to panic as we panicked during Ebola time. Ebola was managed, internationally. WHO means World Health Organization. They put in a lot of efforts and mechanisms and policies to protect the people. And right now, that's where we're headed. Because right now in Kenya, you're putting, what they call it, the CAP 242. CAP 242 is a public health act that is enabling the president and the CS to lock down every bar right now, every social place, so that they can contain the spread of this pandemic within our borders.
That was good.
Yeah, it was. It was. I just have one question.
She asked very tough questions, yeah?
I'm raising up my hand. Can I ask him a question?
Yes,
Am I
you
allowed to? Then how, would you say that coronavirus, this COVID-19, it's more contagious than all the other viruses that we've had? Is it, you can contract it very fast? Because I've never seen our country be in so much panic, like all these rules about closing the bars and the clubs and everything. They're very intense right now. I've never seen it with the case of Ebola or any other. Could you just kindly explain that? I'm sorry, love. Yeah, let him take it over.
Yes. So the incubation period for coronavirus is 14 days. Mm-hmm. It actually ranges from 1 to 14 days. And the nature of the disease and the virulence is so fast and so extreme, mm-hmm. Causing countries to lock down. Like Italy took a lot of time before the lockdown. Mm-hmm. So I'm actually happy that our leadership, the government has taken in measures to start locking down all our social places, mm-hmm. because when you get infected or you get exposed to this disease, then chances of it going south is very fast, because mm-hmm. it goes all the way into your lungs. It causes pneumonia, very severe pneumonia. And after, the pneumonia causes you to lack oxygen. When you lack oxygen, you lead to kidney failure. You also lead to, liver failure. And eventually, even, the brain will not get the oxygen you need to live. Mm-hmm. And that's how people are dying. Mm-hmm. So because of the way it has spread so fast in very few months, it is a public health concern, not only nationally, but globally. And that's why everybody, in fact, right now in the US, in Kenya, and many other countries, there are no universities, no school, because it is spreading very fast. Okay. And I like the measures that the government has put. Even in supermarkets, you need to have 1.5 meters.
Okay, back to you, Petra.
Thank you.
Yeah.
Is COVID-19 more a health crisis or economic crisis?
Wow, good question. COVID-19 is both a health crisis, and right now, strongly, it is becoming an economic crisis. It is a health crisis because many governments, one time, let me tell you a story. One time, Bill Gates was on a TED Talk, 2015, and he predicted that the world is not ready for a pandemic. In fact, if there were to be bioterrorism or any kind of microbe that has been published in a lab or just naturally occurring, like this one could be naturally occurring, then you find countries are not ready, because our health systems, and our health systems have got so many pillars and blocks that make up a whole, like the way you play, blocks. So you have the whole health system, which has got financing, it has got health workers, technology. Now, when you have a weak health system, then a country is not able to prevent the occurrence of these pandemics. For example, it has caught the whole world flat-footed. Now picture this, Petra. We have got every commander-in-chief. They are always ready for war. In fact, some soldiers die without ever going for war because they are always preparing, you know, doing push-ups and press-ups and doing everything, getting ready for an unknown enemy out there. But our health systems do not prepare for war. For war, because in public health, we don't fight people, we fight viruses, we fight bacteria, we fight all these things. But the challenge is in Africa and in many developing countries, we focus a lot on the hardware, the facilities. We don't focus on prevention. We don't focus on what we are doing now. Not right now, you can't find any sanitizer in a supermarket because, oh my God, we need to wash our hands. Remember, also washing hands helps you to protect against diarrhea and other common flus. So we need to reorganize, rewire, re-engineer the thinking of our leadership at the national level, our presidents, our county bosses, to put in more money to community health workers, to public health officers, to the people who sell health messages to the homes and households, without necessarily waiting the day you'll be sick. It's just like going to the gym. You know, you go to the gym because I know if I keep eating, you love chips? Ah, you don't. Hey, well, good job. You don't love chips.
I love chips.
Okay, you love, not chips, yeah.
I love chips.
So if you want to prevent diabetes and hypertension and cancer, then you need to know, I don't need to smoke, I don't need to, you know, take alcohol, I need to exercise more, you know. So the same thing to our health system. If we are to prevent these pandemics, then we need to invest in health education for our people, tell them, wash your hands, sanitize, clean, use jik even on the floor. You have a toddler, you might sanitize everywhere, but if you don't sanitize the floor as well, use jik on the floor, then the toddler can also get exposed. Yeah, continue. Back to you, Petra.
Should children stay indoors for 30 days or can they play outside?
Wow, good question. In fact, today, Petra, my son, he came over, so his friends came over at home and they said, we want to play with Jazzy, we want to go there and play with him. And they had all their bikes and everything, and I told them, okay, this is a very hard decision. Guys, I'm not going to allow Jazzy to get out of the house because I actually live next to Mbagadi Hospital, so I'm just, trying to, take care of the family. And in the estate, I'm trying to tell these messages of self-quarantine, stay at home, don't travel, don't expose yourself. So for kids, we have got very good alternatives. Play chess. Do you love chess?
Yes, nice. I do.
Yeah. We should have maybe a game of chess after this, on one of these fine days. And, do checkers, play with blocks. And there's so many programs that have been supplied by KICD and those people who homeschool. We can plug into those videos and watch documentaries, stay at home and engage. And also every time, go to your mommy's bedroom. Hey, kids at home, do the same. Mommy and daddy, wake up, let's play. You go down, play downstairs, make whole hell out of the sitting room. Play at home. And after 14 days, and another 14 days, and probably another 14 days, maybe Kenya will be sure whether you have contained the disease or not. So for all those kids at home, guys, stay at home for you to be safe, because we want you alive.
They feel like they're being grounded. Being given a leeway, you can stay home for a month, but you cannot leave the house.
But from one of my friends, she's actually great. She actually wants to stay indoors for like 42 days.
Oh man, that's great self-quarantine, but she needs to be allowed, actually you can use YouTube and do some dances, because you don't want to stay, you have a lot of energy. All kids have energy, so make use of music, make dances, play games. Charades. There's so many games kids can play at home, and parents need to invest in those games right now, because again, too much of TV is not good for kids. Yeah.
Okay. Petra, you have more questions?
Yes.
I'd like us to wrap up.
I understand that COVID-19 was transitioned from a bat to a human. Should we be afraid of bats?
Well, there are people saying bats, others are saying snakes, like SARS, the one I talked about, the severe respiratory syndrome came from civet cats. They argue MERS-CoV came from camels. So there are so many, they say Ebola came from, interaction with monkeys. So we have got a lot of people researching on where exactly, but what I can say is, yes, COVID-19 is a zoonotic disease. Zoonotic means it is transmitted from animals to humans, and then from humans to humans. However, that does not mean that now you need to be scared and not interact with your pets and birds, because right now, research people, we have not seen a human right now contracting it to an animal, but it has been the other way around, and that's why we call it a zoonotic disease. And so don't be scared of your pets, you know, but always make sure you clean your pets. For example, if if you have a cat or a dog, it runs outside, you never know who touches it or whatever it touches. So when the cats and dogs come back home, make sure you sanitize them, make them, you know, wash them, and don't expose them. Also quarantine those pets. Yeah.
Okay, so the last question is, how can we best protect ourselves from COVID-19?
So one of the things that is critical is hand washing. Hand washing is a high impact intervention that not only removes germs, but also chemicals from your hands. Do you know how to wash your hands?
Yes.
Let's
You're
assume
saying
water
happy
is for you.
birthday.
Show me how you wash your hands.
Well, when I wash my hands,
Yes.
I also sing happy birthday 2 times.
Nice.
To make sure that I've washed properly.
Can you do me a demo? You have time?
We are running out of time.
Okay, we are running out of time. Okay, just finish.
So should I do the demo?
Yeah, go
Yeah,
ahead.
sure.
Okay.
Sure, the kids at home.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Petra. Happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday, dear Petra. Happy birthday to you.
Nice. Very good. Good job. So one thing, did you remove the dust from the fingernails? Assuming you
Yes.
have manicure?
Yes.
Nice. Good job.
Good job, Petra.
Very well. So hand washing is very critical, and you have taught very many kids at home how to wash their hands. You know why you sing it twice?
Because happy birthday is not 20 seconds.
Hey, well done. Your mom has done a good job, yeah? Or is it your teacher? And secondly, cough etiquette. Whenever you cough, flex your elbow.
It's like a dab, eh?
Do you know that dance? Can you do one? Nice. Good job, yeah? So you know, that's cough and sneeze etiquette. Don't spread the virus droplets. And the other thing is the social distance. 1.5 meters, 2 meters. 2 meters like 6 feet. So there's a lot of debate. Is it 1 meter? Is it 1.5 meters? Is it 2 meters? The thing is, it needs to be at least 1 meter. And wash your hands every time. And disinfect every surface, the doorknobs, even the lifts. The doorknobs, everything. Even the rails if you live in an apartment. Sanitize them.
Just stay home, Petra. I think that's
And
the...
staying home is the
Just-
safest. And then avoid travel. There are many Kenyans going to, you know, so many places. Just stay at home.
Currently, yeah. All right.
Thank you.
So
My
maybe
name-
my question for you,
Oh, sure.
what would you like to be when you grow up?
So I would like to be a lot of things, but I think I would like to be a vet when I grow up.
You would like to be a vet when you grow up. Nice. You have a pet?
Yes, I do.
Good job. I wish you all the best, and I think you make a very good pet. Not a pet, a very good vet. Thank you, Natalie.
At this particular point as well, we are going to actually close our primetime bulletin and I've had such an amazing time during this particular bulletin. Petra, Aya, who's supposed to take my job, but I'm glad you want to be a vet now. So I think my boss will be just fine keeping me around. And of course, public health specialist, that's Ken Ogendo. I really do appreciate you guys gracing us with your presence. This has been Metropole TV's Primetime News. My name is Nina Shaban. You want to close it?
Yes,
Yeah.
thank you for watching. My name is Petra.
Okay, go ahead.
My name is Ken Ogendo. Pleasure to be here.
All right. Thank you so much, guys. I hope you have taken a lot of advice home, yeah? So anyway, just stay home. If you've been told to stay home, work from home. Let's not give this COVID-19 a chance to kill us. Have a lovely night.